Hi class. I wanted to do a quick video on probe maneuvering. I wanted to show you just like a walkthrough. Okay, so we pretend this is my patient, my towel patient. Of course, this is head, this is feet for the mom. Okay, first and foremost, I always say, okay, so we're going to see what position the baby is in. My probe, it's different techniques to how you can do this. I'm in a transverse as I'm looking to see what position the head is in. And so I start transverse. I know some start sag, but I do start transverse. I locate the head. In this case, okay, head is down. I show head is down. I take a picture of that. This is how my probe is. You see my marker. And then I scan up into the chest wall of the baby or fetus. And then I see, because we know that the head is down, and so we assume the left sided structures are clockwise. We're already at a 90-degree rotation. And so it's all about moving upward. Okay, so we move into the chest. We'll see the heart, and then stomach. Okay, now in the case if you do start sagittal, you document that head is down, then you turn 90 degrees and then sweep up or slide up. Okay, so slide up. Now say now we're established that situs is correct. Now we want to go through the standard heart sweep. Okay, you're still going to do that in a transverse plane. So you'll do it just like that in a transverse plane. And then as for sweep, I start at the 4 chamber. And then from the 4 chamber, we're sweeping like this. Because how we're sweeping? Towards the head. Okay. Now, in the case head was up, say head's here, we're in the transverse plane, head's here, we located the heart, and then in this case, we want to sweep upward towards the standard heart sweep, and so we're going to do that by doing that. And that's sweeping, okay? Now, as you sweep, going back down to our vertex, baby. As you're sweeping through, remember 4 chamber, LVOT, RVOT. You see, just kind of angle like that, sweeping through the baby. So LVOT is slightly like on that left side. RVOT, you may have to tilt your probe just like that. As you're sweeping through the RVOT, kind of just angling just like that up into the mediastinal structures. Now say we did our standard sweep. Now we want to perform the sagittal views. As we're trying to or want to get the aortic arch, I usually start like this and then elongate it to here. Okay, so now you kind of have to do like a heel toe sometimes occasionally to visualize the head and neck vessels, just to get a good clear visualization of those vessels, okay, for the aorta. Now ductal arch, because it is the superior of the heart, sometimes we have to kind of angle in just to get the ductal arch in. Now from the aortic arch level, so we're now elongated here, we want to sweep into the short axis. I'm sweeping either this way, you can see here, or if I want to do like a short axis plane, you can kind of go like that to get that. Now to go further into the IVC, remember to extend it into the liver, and that's where you practice in more that heel toe. It's just kind of maneuver. Okay. All right, so it's just to give you the concept. It's much easier as you're scanning to see the direction and so forth. And so I just wanted to give you just a brief overview of that.